Have you been feeling exhausted no matter how much sleep you get? Experiencing sudden muscle cramps that wake you up at night? Feeling more anxious than usual? Or maybe your heart's been racing in ways that worry you? Well, there's something I want to talk to you about today that affects more people than you might think. And the frustrating part is that most people don't even realize what's causing their symptoms. I'm Dr. Ryan Westbrook, and I've spent years helping patients figure out why they feel terrible when all their standard blood work comes back normal. One issue that keeps coming up again and again is magnesium deficiency. And I'm willing to bet that if you're watching this, you or someone you love might be dealing with it right now. Here's the thing about magnesium that most people don't understand. It's not like vitamin C deficiency where you get scurvy. Magnesium deficiency sneaks up on you. It creates this constellation of symptoms that seem completely unrelated. So people bounce around from doctor to doctor thinking they have anxiety or a heart condition, or maybe they're just stressed. But the real issue? Their body is starving for magnesium. Today, I want to walk you through what magnesium actually does in your body, why so many people are deficient, and most importantly, what the warning signs are that you need to pay attention to. Because here's what I know from my practice. When people understand what magnesium does, and when they recognize their symptoms, they feel so much better. Let's start with the basics. Magnesium is what we call a mineral. It's an electrolyte, which means it helps conduct electrical signals in your body. And I know that sounds scientific, but here's why it matters. Your body needs magnesium for literally hundreds of different processes. And I'm not exaggerating. Your muscles need magnesium to contract and to relax. Your heart, which is a muscle, absolutely depends on proper magnesium levels. Your nervous system needs it to send signals. Your brain uses it for neurotransmitter production. Your bones store about half of your body's magnesium. Your sleep quality depends on it. Even your energy production at the cellular level requires magnesium. So when your levels drop, your whole body starts to struggle. Now, how much magnesium do you actually need? For adult women, it's about 310 to 320 milligrams per day. For adult men, it's 400 to 420 milligrams. These are the recommended daily amounts. But here's what's interesting. Most Americans aren't hitting these targets. Studies suggest that about 48% of the US population gets less magnesium than the recommended daily intake, and in some populations, that number jumps to 75%. Why is this happening? Well, there are several reasons. First, our food supply has changed dramatically. Our soil is depleted of magnesium compared to 100 years ago. So the vegetables we grow don't have as much magnesium in them as they used to. Second, we've moved away from whole foods and toward processed foods, which are often stripped of their magnesium content. Third, many people don't eat the foods that are actually rich in magnesium. And fourth, certain medications and lifestyle factors cause your body to lose magnesium more quickly than you can replace it. Alcohol consumption leaches magnesium. Caffeine increases magnesium excretion through your urine. Chronic stress burns through your magnesium stores. If you're taking certain diuretics for blood pressure, you're losing magnesium. Some antibiotics interfere with magnesium absorption. So there are a lot of ways modern life can deplete your magnesium levels without you even realizing it. Let's talk about the symptoms. And here's where I really want you to pay attention, because these symptoms are so common that people often don't connect them to magnesium. They just assume that's how they feel. The first and most common sign is muscle cramps and spasms. If you're getting leg cramps, especially at night, this is something to pay attention to. These might happen in your legs, your feet, your back, even your eye. You know that twitching eyelid that won't go away? That could be magnesium. The cramps can range from mildly annoying to absolutely painful. Some people tell me they wake up in the middle of the night with their calf locked up in a spasm. That's your body screaming for magnesium. Why does this happen? When magnesium is low, your muscles don't get the signal to relax properly. Calcium signals your muscles to contract, but magnesium is what tells them to release. It's a beautiful balance. When that balance tips, you get stuck in a contracted state. Your muscle just won't let go. The second major symptom is fatigue. And not just regular tiredness. I'm talking about exhaustion that doesn't make sense. You could sleep 8 hours and wake up feeling like you didn't sleep at all. You might feel like you're moving through mud all day. Everything feels hard. Your energy production at the cellular level requires magnesium. So when you're deficient, your cells can't make ATP efficiently. ATP is the energy currency of your cells. Without enough magnesium, you can't produce energy properly. So no matter how much you sleep, you feel drained. The third warning sign is anxiety and panic. This is huge, and it's something I see a lot in my practice. People come in saying they feel inexplicably anxious. Their heart's racing for no reason. They feel a sense of impending doom even when nothing bad is happening. Some people even get full panic attacks. What's happening is that magnesium helps regulate your nervous system. It helps your body shift from fight or flight to rest and digest. When you're deficient, you get stuck in this activated state. Your nervous system is constantly on high alert. The fourth warning sign is sleep problems. You might have trouble falling asleep. You might wake up multiple times during the night. Your sleep might feel unrefreshing. Some people have vivid nightmares. Magnesium helps regulate melatonin production and supports the GABA receptors in your brain, which promote relaxation. Without it, your brain stays in a state of arousal even when you're trying to sleep. The fifth symptom is headaches and migraines. Some of the most severe cases of migraine I've seen have a magnesium component. People tell me their migraines improve dramatically when they address their magnesium levels. Magnesium helps regulate blood vessel tone and nerve transmission, both of which are involved in headache and migraine formation. The sixth warning sign is constipation. Now, this might seem unrelated, but magnesium plays a role in smooth muscle function throughout your digestive tract. It helps regulate intestinal motility. When you're deficient, your bowels don't contract and move properly. Food moves through more slowly. This is actually one of the reasons that magnesium is often used as a gentle laxative, because optimal levels support normal, healthy bowel function. The seventh symptom is heart palpitations. This is something people don't always mention to their doctor because they're worried about sounding crazy, but I hear it all the time. Your heart feels like it's skipping beats, or it's racing for no reason, or you feel like it's pounding in your chest. This happens because magnesium helps regulate your heart's electrical activity. When it's low, your heart's rhythm can become irregular. Now, I always want to emphasize, if you're experiencing chest pain or severe palpitations, please see a doctor and get proper evaluation. But for many people, when they optimize their magnesium, these palpitations resolve. The eighth warning sign is mood changes. Depression, irritability, mood swings. Magnesium is required for serotonin production and for GABA, which is your brain's calming neurotransmitter. When you're deficient, your mood can really suffer. The ninth symptom is high blood pressure. Magnesium helps blood vessels relax and dilate. When you're deficient, blood vessels stay constricted, which raises your blood pressure. The 10th warning sign is poor stress tolerance. You feel overwhelmed more easily. You can't handle stress the way you used to. This is because magnesium is crucial for your stress response. It helps regulate cortisol. When your magnesium is low, your stress response goes haywire. The 11th symptom is brain fog and difficulty concentrating. Your thinking feels fuzzy. You can't focus. You forget things. Magnesium supports neuronal function and energy production in the brain. The 12th warning sign is osteoporosis risk. About half of your body's magnesium is stored in your bones. If you're chronically deficient, your bones suffer. You become at higher risk for fractures. Now, here's something important I want to mention. Magnesium doesn't show up on a standard blood test. Your doctor might run a general chemistry panel and find nothing wrong with your magnesium levels. Why? Because only about 1% of your body's magnesium is in your blood. The rest is in your muscles, bones, and organs. So you can have low magnesium tissue levels while your serum magnesium looks normal. This is why so many people are walking around deficient without anyone catching it. The best indicator of magnesium status is actually your symptoms. If you have several of these symptoms, especially the muscle cramps, the fatigue, or the anxiety, there's a good chance you need more magnesium. Let's talk about foods that are naturally rich in magnesium. Pumpkin seeds are excellent. They have about 168 milligrams of magnesium in just a quarter cup. Almonds are great, with 80 milligrams in an ounce. Spinach is powerful. 1 cup of cooked spinach has about 157 milligrams. Dark chocolate is interesting because it's one of the few foods that's high in magnesium and also tastes good. A square or two a day can help. Cashews, macadamia nuts, Brazil nuts, avocados, whole grains like quinoa and brown rice, black beans and other legumes, leafy greens in general, fatty fish like salmon, some nuts and seeds. The challenge is that to get 300 to 400 milligrams of magnesium from food alone, you really have to be intentional. You have to eat these magnesium-rich foods regularly. It's not impossible, but it requires planning. Now, I want to be clear about something. I'm not here to tell you that you need supplements. That's not what this video is about. What I'm here to say is, if you have multiple symptoms of magnesium deficiency, it's worth paying attention to. It's worth increasing your magnesium-rich foods. It's worth looking at your stress levels and your caffeine intake and your alcohol consumption, because all of those affect your magnesium. If you decide that you want to explore adding magnesium, there are different forms. Magnesium citrate is well absorbed. Magnesium glycinate is gentle and well tolerated. Magnesium threonate is designed to cross the blood-brain barrier. Magnesium malate is good for energy. There are many forms and they have different effects. The amount matters too. This is why working with a healthcare provider is really important if you go this route. I also want to mention that magnesium works best when you have adequate vitamin D, vitamin B6, and calcium. These nutrients work together. So addressing magnesium deficiency isn't always just about magnesium. Let me tell you about a patient I saw recently. Sarah came in exhausted. She was sleeping 8 hours and feeling like she could sleep 12. She had terrible anxiety for no reason. Her legs cramped every night. She'd been to 3 doctors. Everyone told her blood work was normal. One doctor suggested she had depression and offered her an SSRI. Another said she probably just needed to exercise more. She was so frustrated. We talked about her diet and she wasn't eating many magnesium-rich foods. We discussed her stress levels. She was running a business and taking care of 2 kids. She drank 3 cups of coffee a day. Her magnesium stores were being depleted from every angle. I suggested she increase magnesium through food, reduce caffeine a bit, and work on stress management through things like walking and deep breathing. 3 weeks later, she came back. Her fatigue was so much better. She was sleeping more deeply. The leg cramps were mostly gone. The anxiety had decreased significantly. She was amazed at what a difference it made. That's what I see repeatedly in my practice. When people address their magnesium deficiency, they feel profoundly better. Now, I want to talk about the relationship between magnesium and specific conditions. Magnesium deficiency is often a component of what we call restless leg syndrome. People feel this irresistible urge to move their legs, especially at night. It drives them crazy. Magnesium often helps dramatically. Magnesium is also important in migraines. There's actual research showing that people with migraines have lower magnesium levels, and supplementation can reduce migraine frequency. For anxiety and panic disorder, magnesium is crucial. It's not a substitute for therapy or other treatments, but it's often a piece of the puzzle. For sleep issues, magnesium can be transformative. It helps people fall asleep faster and sleep more deeply. Here's something else I want you to know. Magnesium absorption can be affected by your gut health. If you have irritable bowel syndrome, inflammatory bowel disease, or other digestive issues, you might not absorb magnesium well, even if you're eating plenty of it. This is another reason why just looking at diet isn't always the whole picture. Stress also affects magnesium absorption. When you're in chronic stress, your body's absorption of magnesium decreases while your losses increase. It's a double hit. Aging affects magnesium too. As we get older, we tend to absorb magnesium less efficiently and excrete it more readily. So magnesium becomes even more important as we age. Women going through perimenopause and menopause often find that magnesium helps tremendously. The hormonal shifts of menopause can deplete magnesium, and adequate magnesium helps with the mood changes, the hot flashes, and the sleep problems. Here's what I want you to take away from all of this. Your body gives you signals. When you have muscle cramps, exhaustion, anxiety, sleep problems, and headaches, that's not normal. That's your body telling you something's wrong. Don't just accept it. Don't just medicate the symptoms. Look deeper. Magnesium deficiency is one of those things that's really common but easily overlooked. And the beautiful part is that it's fixable. You can't always fix things quickly, but magnesium, when addressed, can make a real difference in how you feel. If you recognize yourself in these symptoms, here's what I'd suggest. First, take an honest look at your diet. Are you eating magnesium-rich foods regularly? If not, start incorporating them more. Second, look at your lifestyle. Are you drinking a lot of caffeine? Are you under chronic stress? Can you address some of that? Third, consider talking to a healthcare provider about your symptoms. You don't have to just live with them. The standard recommendation is to get your magnesium through food first. Real food, whole foods. That's always the best approach. Because when you eat foods rich in magnesium, You're also getting all the other nutrients that come with them. You're getting fiber. You're getting other minerals. You're getting all of this nutritional density. But I also know that life is complicated. Modern life makes it hard to get everything we need from food alone. Sometimes additional support is necessary. The key is working with someone who understands nutrition and can help you figure out what's right for your individual situation. One more thing I want to mention. If you're taking medications, ask your doctor or pharmacist whether they might be affecting your magnesium levels. Some medications increase magnesium loss. If that's the case, you might need to be more intentional about getting adequate magnesium. The bottom line is this. If you're experiencing unexplained fatigue, muscle cramps, anxiety, sleep problems, or any of the other symptoms I've mentioned, magnesium deficiency is worth investigating. You don't have to feel exhausted and anxious. You don't have to live with constant muscle cramps. There are answers, and sometimes the answer is as simple as addressing your magnesium. I see this makes such a difference in people's lives. I see people go from feeling terrible and frustrated to feeling like themselves again. And very often, magnesium is a big part of that puzzle. If this video resonates with you, if you recognize these symptoms in yourself or someone you love, please share it. And definitely share your experience in the comments. I'd love to hear about your journey with magnesium. Have you noticed these symptoms? Did addressing magnesium help you? Let me know. And if you found this helpful, please subscribe to the channel. I'm constantly making videos about the things that are keeping people sick and tired, and how to actually address them. There's a lot of information out there that's confusing or incomplete. My goal is to give you clear, straightforward information that helps you take better care of yourself. Remember, you deserve to feel good. You deserve to have energy. You deserve to sleep well and to feel calm. If magnesium deficiency is part of what's been holding you back, addressing it can be a game changer. Thanks for watching. Take care of yourself.